Sarah, can you tell me a little bit about acupuncture?
Of course. Acupuncture is part of a bigger system called Chinese medicine. And acupuncture allows the body to open up. In Chinese medicine, we have a saying, when there is pain, there is stagnation. And when there is free motion, then there is no pain. So using acupuncture allows the body to open up. And the body is set in channels that run bilaterally. So there are specific points to open up specific areas and to allow the body to have free flow, allowing there not to be any pain, and also allowing the body to run smoothly. So it can also help with other aspects such as infertility, Bell's palsy, multiple types of like joint pain, arthritis. I can go on.
So you can say, if I had like a cold, would
Yeah,
I come in to an acupuncturist to have them treat it,
absolutely.
just like a regular doctor?
Yeah, absolutely. When people come in with colds, we often treat it as a symptom of what we call wind. And with wind can come with heat or with cold. So with the term cold, it can indicate a lot of different symptoms for us to get to the bottom of what's wrong with the person in order to rebalance them so that they can better fight against the exterior environment coming in.
Okay. For acupuncture, explain to me what it actually involves.
When a patient first comes in, I do a thorough intake about their background to get a full idea of what their pattern is, because it's much like a car indicator light comes on in the car and it's a symptom. It tells you that there's something deeper going on in the system. So much when we have symptoms of pain or of cold or anything like that, it's a deeper indication of an imbalance going on in the body. So I ask a lot of questions that sound very strange. I also look at the tongue and I look at the pulse, because the tongue indicates a map of the body and the pulse also is a map in itself. And putting those together, I can form a baseline of a pattern that's going on to be able to treat at the root of the problem.
Okay, so basically somebody would come in who would think that they might need treatment for some kind of pain or malady.
Mm-hmm.
And you look at their tongue, and then at that point, what happens?
I look at their tongue, I make an assessment, and what I like to do is to form a full treatment modality, which can include acupuncture and can include herbal medicine and other aspects to go with that. After making my pattern assessment, and based on that, I pick certain points. And I use, the acupuncture needles that are used are very small. They're like a cat's whisker, and they're all very sterile. And it's a very safe and effective treatment. After having someone lie down on the table and inserting these needles, they'll lay down for about 15 to 30 minutes, and then the needles are taken out, and the person can go on their way.
How do you select, or not really how do you select, but you just don't put needles anywhere?
Not
Obviously,
just
there's
random.
a pattern.
Correct. Based on that pattern, specific points in the body are used, because there are organs that are also used in Chinese medicine, but they're not seen in the Western model as that actual space and only that organ. They are a function of the greater pattern in the body, and from those organs run these meridians. So when there's disharmony coming from the outside, it's also related to the inside, because in Chinese medicine the body is viewed as a microcosm of the outside world.
Interesting. So you use needles, and you say they're as thin as a cat's whisker.
Mm-hmm.
And a lot of people don't like needles, and the first thing they think of as needles is this going to hurt, or this will hurt? You know, what do you say to them in terms of that?
I can tell you it is a different sensation. I wouldn't describe it as pain. Occasionally you can feel the needle inserted, but if anything, it might be a quick pinch at the very most. Other than that, it's good to feel a tingling sensation, a sense of warmth, heat, heaviness, and a deep ache. It shows that the body is in motion and interacting with the practitioner's needles.
And what do they feel afterwards? Is there, should I expect to, if I came in, should I expect to feel great now, or is it something that's a prolonged effect, or what?
It varies. It varies on the person and how chronic the issues are. Oftentimes during the treatment, you'll feel waves of motion going through the body, and then afterwards, it might be, if there's knee pain, the knee, it might feel like you've been stretched really good. For women, if there's premenstrual issues, they'll actually feel motion, some more flexibility going on. And then sometimes it'll dissipate in a day or two. Sometimes it's cured right then and there. It depends on the person and how chronic the issue is, and also how the person's lifestyle is, if what they do brings that illness back in.
What are some conditions that you would treat and that you see quite often?
That's a good question. I have seen a lot of premenstrual issues, also menopausal issues, sprains, strains, you name it there, joint aches, arthritis, sleeping issues is another big one, stress, anxiety, Bell's palsy, even stroke, and TMJ. I can go on and on.
Now, this sounds like, I mean, I know that the acupuncture is becoming a little more popular with people. More people have tried it than they have in past years. Is it something that our insurance would cover? How does that usually work?
It's coming along, absolutely. Usually insurance will cover it with like flex spending and whatnot. It's usually denoted with a super bill, but it depends on the person's plan. Sometimes they get aid with insurance, but it's still work in progress.
And how would, so many of us are used to like taking a pill to get get some kind of result or resolution of any condition that we have. How would you, if someone were to ask you, well, why would I want to get acupuncture? What would you tell them?
That's the beauty of it. It's safe, it's effective, it's natural, it's drug-free. Western medicine is a great tool, but it's also very strong. And so it's nice to be able to do this half step and to not have to deal with the side effects of pharmaceutical drugs, of the interactions of surgeries. It's a lot that it can prevent.